The scientific model of medicine is commonly referred to as allopathic medicine. Medical care, as we currently know it, works on what I call the fix-it model. Most people seek a doctor's assistance only when something is not working right. Usually, pain is the signal to seek treatment. In allopathic medicine, the doctor holds most of the power. Patients acquiesce to them, ceding most of their own power in the patient-doctor interaction. That means patients make the doctor responsible for their health. Consider it an explicit contract in which the patient pays the doctor to diagnose the cause of pain and provide treatment. Therefore, fix it. But there is also an implicit contract. Since payment transfers responsibility, patients perceive that they have the right to expect that the doctor will determine a cause and remove the pain. But is that realistic? Let's be honest, there is much in modern medicine that is not understood. It sits paradoxically on a pedestal of omnipotence while operating under severe limitations. Treatments and medications today are miraculous when compared to what was available even 50 years ago. But there is still much that remains unknown about illness and disease. And though modern positivistic research has led to many of those advances, it has also narrowed doctors' choices to a range of accepted diagnoses and treatments. Acceptability is determined by research studies that establish a clear cause and effect as well as possible side effects. Anything that is not empirically measured or observed or fails to achieve statistical significance is generally outside the realm of accepted medical practice. So what is a doctor to do when faced with symptoms for which there is no accepted diagnosis? The implicit contract makes an honest assessment that is, quote, I really don't know why this is happening, unquote, impossible. So the doctor is compelled to give an opinion based on the proximity of those symptoms to something within his or her knowledge base. While that may provide short-term relief, it is not likely to effectively stop the illness or cure the disease. And until the root problem is addressed, the patient will continue to return with a series of new symptoms. On the other hand, there are diagnosable diseases that have no known cure. Yet such prognosis should still not be interpreted as leaving no hope for recovery. Since no one can know exactly the path of an illness or when a patient will die, the, quote, time till death, unquote, is nothing but a probability, an estimate. Yet, nanosis, that is the prediction of death, instills an instant sense of despair, which may be more disparaging than the illness itself. There is considerable anecdotal evidence of patients who die on schedule, even when in a stage of biological remission or recovery.
On the other hand, Brad took his father to the doctor for a checkup. The doctor called him several days later. Your father's lab results came back. I'm afraid I have bad news. He's got a serious illness and has only 6 months to live. I know you have a special relationship with your father. Would you like to break it to him yourself or have me do it? Brad thought for a moment and mumbled back into the phone. I'll do it. 5 years later, the doctor ran into Brad and his father at the supermarket. As Brad's father ambled away toward the frozen food section, the doctor pulled Brad aside. I'm so happy to see your father recovered. He seems to be in excellent health and good spirits. Then pulling Brad a little closer, by the way, how did you break the news to him 5 years ago? Brad got a sheepish look on his face. I guess I sort of forgot to tell him.
The wonder is that while some diseases are quite intractable and resistant to accepted treatments, few are by themselves 100% fatal. While it may be true that a statistically significant number of people do indeed die from any given disease, there are still people who experience miraculous recoveries. It's unfortunate that many physicians share devastating diagnoses with their patients in a manner tantamount to a death sentence. but in a macabre way, it fulfills the implicit contract. One thing is certain, we all have to die. The doctor who predicts death, as in the case of a terminal illness, will be right sooner or later. No, it doesn't fix the problem, but it gets the doctor off the hook by making the argument that is a problem no one can fix. Considering the alternatives that lie outside acceptable medical practice, I consider the terminal diagnosis to be simply the result of an inability to consider new options. Doctors Bernie Siegel, Carl Simonton, and Deepak Chopra would likely agree. They each describe exceptional patients who have defied dire prognosis. Such patients refuse to believe the negative and, through their own faith and those who support them, survive nenosis. Because patients expect doctors to do something, to prescribe pills or treatments, that is exactly what they do. They treat the symptoms. The reality is that while a drug may alleviate pain, it doesn't really get at the cause of the problem. Further, buying into any serious prognosis means that even as physical pain is relieved, suffering continues.